Today is a really exciting opportunity to host the Surgeon General of the United States and to shine a light on youth mental health, because we know that children and young people across the United States are struggling. And so today we're having a conversation about the things we're doing right here in Pittsburgh and the role that we're playing at UPMC to help support the emotional and social well-being of our young people.
So one of the things that we think is really incredibly important in terms of behavioral health and more importantly behavioral wellness is that we want to be a partner with other stakeholders in the community as it relates to behavioral health. We recognize that there is a component of behavioral health and wellness that is about the medical aspects of it. But really we are partnering with social service organizations, we are partnering with schools, we are partnering with payers, we are partnering with other stakeholders to make sure that we're a part of the solution to what is a very complicated process.
The one thing about Pittsburgh, we pride ourselves with working with one another. And when you have people within the community that are now going out there, volunteering their time, trying to change what's going on in their communities, and then being able to speak about what they're doing and what their passions are, we all can align together to make sure that we're making a powerful footprint in the city of Pittsburgh and around southwestern Pennsylvania.
I'm really glad to be here in Pittsburgh as part of the broader initiative that I've launched around youth mental health. To me, this is the defining public health issue of our time. And I'll just say that I've been really impressed by the people I've met here in Pittsburgh. I've talked to community-based organizations that are helping to address trauma with youth. I've talked to organizations that are bringing mental health services into schools. And I've talked to foundations as well that are putting more and more resources into addressing the youth mental health crisis. So this is promising. It's what we need to do more of. It's part of the conversation we need to have. And I'm going to keep working on this issue, as long as I have the privilege of serving.
We humbly and confidently ask you for your blessing on this place.
This is a really exciting day. These ORs have not been renovated since the 1970s. So this was long overdue.
What's going to be different from what we've had for 50 years here is that everybody's going to be in one location. We're in the post-op areas, we'll lead right into the new ORs, and the PACU will all be connected, we'll be one family.
This is a project that we have had in development since 2017. We had a lot of staff participation early on in the design to make sure that the rooms were the right size, that they were configured correctly, that they were flexible.
This is what we're looking forward to, this is the first phase of 9, and that when it is all complete, it will be great for every patient and for every staff member who really dedicates their day to taking care of these patients.
We're really excited for how the space turned out and just the reaction of the staff, the clinical staff and the patients when they get an opportunity to really experience the space for the first time. And just to see it really come to fruition is amazing. And we're looking forward to the next phase and then the next 5 years as we wrap the project up.
We are celebrating our patients here at UPMC, Central Pennsylvania, weight management programs, both medical and surgical weight loss. So our patients are invited, and we are celebrating post-op patients as well as medical weight management patients 1 to 5 years after their surgeries, if they had surgery, or their medical program success. So we have an amazing, completely free program to celebrate with our patients tonight, including a red carpet event where they're going to come out and reveal their new, healthier selves. We have amazing gift baskets. We have our surgeons and physicians here on hand. We're gonna dance, we're gonna celebrate, and we're just gonna love up on our patients, honestly, because they have worked so hard and come so far, and that's we're here just to celebrate with them.
On behalf of UPMC Mercy, thank you for joining us. And in just a few minutes, we will be among the thousands of hospitals across the country raising a Donate Life flag to honor donors, to recognize the recipients who received the gift of hope, and to kick off National Donate Life Month.
In July of 2019, I received a liver transplant. The amount of emotions that you feel of getting the extra chance, a second chance at life, it's hard to put into words. Other thing that changes you, you realize how precious things are.
We're all here to celebrate National Donate Life Month. Each donor
can save up to 8 lives. One donation is 8 lives.
100,000 people are on the list right now. And sadly, between 15 and 20 people will die each day waiting. Please become a donor if you're not. Only 50% of people in Pennsylvania are donors. Let's make some good memories. How grateful I am. The last thing they did on earth, they gave life to someone else. And that to me is very righteous and selfless act that we can all do.